Today, let's talk about some big tests that you're going to experience in your second trimester. We're going to talk about some tests that are optional, some that are routine, and some tests that are good for your partner to be there. Coming up. Hey, my name is Josephine. I'm a registered nurse and currently also pregnant. In my second trimester, I'm 22 weeks pregnant. If you're new to my channel, I help educate new moms on the journey to pregnancy and motherhood and hopefully help inspire you to be the best mom you can be. If that interests you, consider subscribing. The first test we're going to be talking about are all blood or lab tests, and usually this is done around the 10 to 18 week mark. Now, these blood tests are all optional, and we're going to be talking about what diseases these blood tests are testing for. Now, some of these are not covered by insurance, so you definitely want to make sure you call your insurance company and ask if they cover these. If they don't, then obviously you don't need to opt into doing these tests. If you have a family history of any of these genetic diseases we're going to be talking about, definitely consider testing even if insurance doesn't cover, just so that you are prepared and aware of when baby does arrive. Number one is cystic fibrosis and spinal muscle atrophy. And cystic fibrosis is an inherited genetic disorder in which the cells that produce mucus are abnormal. You know, normal mucus is supposed to line and lubricate a lot of the organs, so a little bit of mucus is normal in the body, but with cystic fibrosis, the mucus becomes glue-like and very sticky. The mucus can get trapped into your organs and tissues, which can lead to scar tissue forming and cysts to form. And that's where cystic fibrosis gets its name from, is cystic, meaning comes from cyst, and fibrosis actually is the medical term for scar tissue. Scar tissue does not function in the way that a normal healthy tissue would. And in these patients who have cystic fibrosis, the lungs are the main concern. If you have a huge accumulation of mucus in your lungs, that can hinder breathing. Okay, let's talk about spinal muscular atrophy. Now, this is a genetic disorder or disease in which the motor neurons found in your brain are lost in the spinal cord. And what these motor neurons do is they send signals from the brain to the spinal cord on movement, reflexes, things of that nature. And so when you have this disease, then you actually start losing movement in your muscles, because now the neurons are not sending signals to your spine for you to move. And so actually that's where the name comes from. Spinal comes from spine, muscular from muscle. Atrophy means wasting away, so you don't get any of the muscle movement that you would see in normal human beings. Number two, they test alpha fetoprotein and spina bifida. So spina bifida is a neural tube defect where the spinal cord and the spine don't form properly. Spina bifida actually literally means split spine. This is so important to know, is that spina bifida is mostly preventable. They say take 400 micrograms of folic acid every day along with your prenatals, or take a prenatal that has folic acid, 400 micrograms in it, to prevent spina bifida. This disease is actually formed in the first 28 days of a baby's life when you may not even know that you're pregnant. It's really important to plan, if you can, when you're trying to conceive, and take those folic acid 400 micrograms every single day before you're pregnant to prevent you from getting spina bifida. Okay, number three is Tay Sachs screening, which this disease is more common in specific descendants. Tay Sachs disease is where you have a loss of an enzyme that breaks down fat in your body, or breaks down fatty substances in your body. This enzyme is very important because what it does is, in the development of the baby, if you don't have this enzyme, you have fat substances that build up in the brain of the baby. And it can lead to a lot of toxic levels of this substance in the brain, which can lead to blindness, decreased muscle ability, and even death. So if you do have a history of Tay Sachs, then you definitely want to make sure that you get this done, because most of the time it can be fatal. Number 4 is the NIPT testing with chromosomal screening for Down syndrome, for Edwards syndrome, and it also reveals the sex of the baby. This is the most common test that most women opt into doing. So Down syndrome is where you have an extra chromosome in chromosome 21, and in medical terms, Down syndrome is actually called trisomy 21 because you have 3 chromosomes in the chromosome 21 instead of 2. So Edwards syndrome is kind of similar to Down syndrome in the fact that it has a extra chromosome, but the placement of that chromosome is different. So in Edwards syndrome, you're going to find an extra chromosome in chromosome 18. Edwards syndrome is much more serious than Down syndrome. You'll see Edwards syndrome with low birth weight, an abnormal shaped head, and organ defects. And unfortunately, Edwards syndrome usually leads to death in the womb or shortly after labor. So now that we've done the lab tests that you need to be aware of, that your doctor will ask if you want those tested or not, let's talk about some ultrasounds, or a big ultrasound that you're going to be going through in the second trimester, which is the full anatomy body ultrasound scan. Usually this is done anywhere between 18 to 22 weeks, depending on your provider. So this ultrasound is the lengthiest ultrasound that you'll have in all of your pregnancy. Really, this ultrasound is to make sure that every part of your baby is looking healthy and is on the right track in growth. Some things they're going to be looking at are the head, specifically the face. They're going to be looking at to make sure that the baby doesn't have a cleft palate. They're going to be looking at the legs, make sure you have 2 legs, make sure you have 2 arms, 2 feet, 2 hands, that the spinal cord looks good, that they don't see evidences of Spina Bifida. They're going to look at the brain to make sure that there's no swelling. They look at the heart to make sure that there's no congenital defects, because unfortunately, heart problems is a big factor in fetal death. You're also going to see how much the baby weighs in ounces. You can also ask which part of the growth percentile they are a part of. And for me and my husband, unfortunately, they couldn't see the heart and the bladder. So we got to go back and do a second part of the anatomy scan to make sure that the heart of our baby boy is good. Now with the full body anatomy scan, you want to make sure that you do a couple of things before this exam. You want to make sure that you have a full bladder. So you want to hydrate, drink that water before you go to this exam. Now, why, you might ask? Having a full bladder actually helps visualize the pelvic organs a little bit better. Now, I will say with this exam, if your facility is allowing for visitors to come, this is a great opportunity for you and your partner to see and visualize the baby. So this is a must, in my opinion, for you and your partner to come. Now, if your facility doesn't allow partners to be there, some facilities are allowing you to FaceTime. Some facilities are allowing videos, but definitely make sure you check with your facility to see if they are allowing partners or not. And the last test we're going to be talking about is the glucose test. Now, I'm sure you've already heard about this if you are pregnant. I'm sure other moms have told you got to drink this disgusting drink, la. Let's talk about why we need to take this test. So the glucose screening test is to check to make sure you don't have gestational diabetes, which just means high blood sugar during pregnancy. And this only lasts during pregnancy. The glucose testing is usually done anywhere between 24 to 28 weeks, depending on your facility. So the 1-hour test is usually the most common that you'll see. What you'll do is you'll pretty much, depending on how your facility likes to do this, most facilities will say drink and eat normally like you do, and then come into the office. They will go ahead and have you drink a sugary drink, and then you'll wait 1 hour. After 1 hour passes, then you'll get a blood test, and that blood test will determine whether your blood sugar is within a normal range or if it's high. If it is high, then you are more at risk for the gestational diabetes. So what they will do is ask you to come in for the second 3-hour test, which is longer in duration, but it is a lot more thorough to make sure that you potentially do have gestational diabetes or not. One thing to note is that if you do fail the first test and say that your blood sugar is high the first time around, that doesn't actually necessarily say that you have gestational diabetes. So don't freak out, don't be alarmed. Just wait till your next appointment for the longer testing, and that will actually tell you if you have gestational diabetes or not. That actually happened to my sister. She failed the first one, went to the long test, and she was fine. Now, if you have any questions on what we talked about today, definitely feel free to leave them in the comments below. I would love to answer them for you and help you on your journey. And if you got value from this video, definitely make sure that you hit that subscribe button. And remember, guys, it's always a great day to grow. Grow in life, grow your baby, grow emotionally, and don't forget to grow spiritually. I will see you guys in the next video.